In the past, a lot of women have delayed treatment because they thought surgery was the only option available to them, but now we have so many other non-invasive options for treating fibroids. We've had really great advances in research, and we now have medication options to help control the symptoms associated with fibroids, and now we have medications that actually treat the fibroids themselves. So commonly we've used birth control pills, and those work great to decrease heavy menstrual bleeding. Sometimes cycles may still be heavy because we're not treating the fibroid itself, but it does help to treat those symptoms associated with the fibroids. We also have a medication called tranexamic acid that works with the clotting system so that heavy bleeding is not as heavy during cycles. Again, this doesn't treat the fibroids themselves, but it does reduce that heavy menstrual bleeding associated with the fibroids. We now have 2 FDA-approved GnRH antagonist medications. These are medications that you can take by mouth, and they help to decrease the hormones that we produce that feed those fibroids. They are FDA-approved for treating the heavy menstrual bleeding associated with fibroids. We often use levonorgestrel-containing IUDs for treating heavy menstrual bleeding associated with fibroids as well. So these are IUDs that have a hormone in them that help to thin out the lining of the uterus. In fact, 85% of women have no period after 3 months. However, all patients that have fibroids may not be a candidate for this type of IUD. Because the IUD is put inside the lining of the uterus, if patients have fibroids in that location, that may cause them to actually dislodge the IUD, and so they're not candidates. Moving on from our oral options, we have an injection called a GnRH agonist. This eventually decreases the hormones that are feeding the fibroids. This helps the uterus to get smaller, the fibroids to get smaller, and it decreases the heavy bleeding associated with fibroids. So anytime we're making a decision about what option is the best option for treating fibroids, that really is a shared decision-making process. As a physician, I try to determine from my patients what are their goals for treatment. If I have a patient or we have patients that want to treat their symptoms associated with fibroids, but they want to avoid surgery, or if they're not good candidates for surgery, they are good candidates for these oral options. Really, it's a conversation that has to happen between the physician and the patient to determine her goals for treatment, to determine which option is the right one for her.